Isha, I will be myself. Your life.
Hi, Assalamualaikum and good day to everyone. Okay, thank you for joining this walk class session. Okay, before we start, please like, share, and subscribe to our YouTube channel. All right, so before we start, I would like to introduce myself. My name is Misha Irina. I'm an exercise therapist and also a walklah kaki. All right, so today I will be sharing with you some tips on how to control your sugar levels. All right, so first, let me say it is never too late to take care of your health. If you are on your 20s, even you are 45, or even on your 60s, please keep your body moving because by becoming more active, um, it can give you a lot of benefits and also can help control your sugar levels. So what is actually blood sugar? So blood sugar is actually a concentration of the glucose in your blood. So these are the guidelines that given by the Kementerian Kesihatan Malaysia. So if you are normal, you have no underlying condition, these are the readings that you can follow. All right, so when your sugar level is high, we can call it as diabetes. So so there are three types of diabetes that can occur. So the first one is the type 1 diabetes, which occurs when your pancreas cannot make enough insulin. Why? Because the body immune systems attack the pancreas and destroy the insulin. So that is why you see when people with type 1 diabetes, they usually inject themselves with insulin shots. And type 2 diabetes is when the pancreas cannot secrete the insulins. Okay, so usually type 2 diabetes, people with having a very poor lifestyles, so they can get type 2 diabetes. And the third diabetes is called gestational diabetes, which occurs due to pregnancy. So mummies, please check your sugar levels. Okay, all right, so how does exercise affects your blood sugar? So when you exercise, your body will use the primary source of energy, which is the carbohydrates. So carbohydrates come from the food that you eat, and it is converted into glucose and being stored in your muscles and also your liver. And if it has too much of sugar, it will be stored in your tissue cells, your fat cells. All right, so during your exercise, your muscle uses this glucose from your storage. So this trigger the insulin and promote the increase of the insulin sensitivity, which can cause lowering the blood sugar. So when you're doing exercise, 20 minutes, 30 minutes, 40 minutes, 45, or even 1 hour, it can cause to lower down your blood sugar level will drop and cause hypoglycemia. Okay, so what are the symptoms of hypoglycemia? So the symptoms, you can become shaky, you become more sweating, dizzy, fatigue, and sometimes headache. All right, so how to avoid hypokalemia is by first, you can eat half an hour before you start your exercise. Okay, so this can help to maintain your sugar level inside your body. All right, and second one is avoid insulin injection before you exercise. And then after you exercise, check your blood sugar. Okay, maybe 2 to 4 hours after you exercise, check your blood sugar. All right, and then always, if you are a diabetes patient, please keep simple carbohydrates during your exercise, because simple sugar can quickly absorb into your body and increase the sugar levels. All right, and then if you feel any of the symptoms, please stop exercise if you feel uncomfortable and all of these symptoms. All right. Okay, next. So besides exercise, you also need to properly manage your carbohydrate intakes. So how? So carbohydrate, there are two types of carbohydrate. The first one is complex carbohydrates, also known as the good carbohydrates. So because it helps maintain the blood sugar. How? So because complex carbohydrate is known with its low glycemic value, which makes it slowly absorb and digest into our systems. So this low value makes us feel full in a long period of time and sustain high energy level. So this can help. If you can see all of this, it can help to aid in weight loss and also reduce the risk of having a chronic disease. All right, then we have simple carbs, which is the opposite of a complex carbohydrate. So what is actually a simple carbohydrate? So simple carbohydrate is also known as the bad carbohydrate. Okay, why we say it is a bad carbohydrate? Because simple carbohydrate have a high glycemic value that can cause a quick increasement in our blood sugar. It absorbs quickly into our body and digests quickly in our body. That makes us feel hungry in a short time. And that is what makes us feel tired and fatigued, all right, and less energy. So taking too much of, I'm not saying we cannot take, but we cannot take simple carbs, we can take. But if you are taking too much of this simple carbs, simple carbohydrate, it can lead to chronic diseases such as it can cause, as we know, simple carbs can cause uh, uh, obesity. So that is why you need to choose properly. You need to choose whether you want to take complex carbs or simple carbs. Okay. All right. So the last one is I want to share on how to replace your white sugar. So people keep saying, how am I going to cut my sugar? Very simple. We have two types of natural sweetness, which is the stevia and also monk fruits. So these two are known for their 0-calorie natural sweetness. So if you now want to have a healthy life, healthy uh, eating, you can start replacing your white sugar by using these two type of natural sweetness. So I'm looking at the comment now. Hi everyone. Yeah, say no to diabetes. Right. Good evening, everyone. Thank you. Okay, so that is all my sharing for today. So if you are normal people, you don't have diabetes, please take care of your health. If you are a diabetes patient, please take care of your health. Exercise regularly, and don't forget to maintain your what we call healthy food. Okay, you don't have to eat um, nutritious food, but keep it balanced. Okay, Kementerian Kesihatan also said we have to do the suku-suku separuh, and that is what I'm doing too. Okay, I don't use I don't I'm not a person that eats nutritious food every day, but I always do the suku-suku separuh, and I always replace my white sugar with this kind of natural sweetener. I always use stevia to replace my white sugar. All right, so you can, I have questions. Where can I get a healthy sweetener? So this healthy sweetener you can get from any, what we call groceries. The stevia is very easy to find. You can find the stevia on the groceries. It is not so expensive. It's cheap also. Where Okay, I have a question from Adli. What is the example of complex carbohydrate that is recommended for a diabetic patient to eat? All right. So a complex carbohydrate that is recommended for the diabetic patient is you can take whole grain fruits, take a lot of fruits, and eat more vegetables. So it is a very simple. You don't have to buy expensive food. All of these complex carbohydrates also can be found in the grocery stores. Okay. Sweat Smart asks, should I exercise if I am under medication? Yes, you can exercise if you are under medication, but please refer to your doctor first. If you are a beginner, if you are starting to exercise, please ask for your doctor's approval before you start your exercise. Okay. All right. Okay, is simple sugar totally bad? No. Okay, simple sugar is not bad if you are taking it in a proper way. That is what I say. Because you taking too much of this simple carbohydrate, that is why it can lead to chronic disease, chronic complication. So please take simple carbohydrate in moderations. Can you explain low and high glycemic index? Wow, this is a very hard question. I'm sorry. I'm not very good at explaining low and high glycemic uh, index food. Sorry. Can I get some example of complex carbs food? Yes, you can. You can take brown rice, brown sugar. Uh, uh, you can take apples. These are food that is a complex carbohydrates. Okay. Is there any more questions? I'm sorry, Ethan, because I cannot explain the low and high glycemic index. I will, I will study more on this. Thank you for the questions. Homichi, how does our body regulates blood sugar level when our blood sugar is low? How does our body regulates blood sugar? I'm sorry, I don't understand. So can you share your daily carbs intake during days of exercise? So I personally I took I took normal eating. I take rice, but I do suku-suku separuh, like the Kementerian Kesihatan said. I do glycemic. I do suku-suku separuh in my daily intake, food intake. Yes, low glycemic index does not fluctuate our blood sugar. My uncle has been amputated. Can he still do exercise? If yes, any suggestions? Yes, he can still exercise, but I would say your uncle must be first ask from the doctor's recommendation. So if he can do the exercise, we can do a very low intensity exercise. High glycemic index will cause hypoglycemic, especially if you take them before you work out. What is suku-suku separuh actually? Sound interesting. So suku-suku separuh is actually recommended by Kementerian Kesihatan, where you do half portions of your food in your daily intakes. So you will cut off some of your carbohydrates. You eat half of your carbohydrates, half proteins, and also fats. So that is what suku-suku separuh is. Thank you everyone for the questions. Thank you everyone. Between hypoglycemia and hyperglycemic, which one is more dangerous? I would say both of them are dangerous because and please, if you have this kind of symptoms, please stop exercise and please get doctors. Please refer to doctors immediately if you have this kind of symptoms. Okay, thank you everyone. Thank you. What should diabetic patients eat after they exercise? All right, so people with diabetes, they can eat um, 30 minutes after the exercise. They can take carbohydrates like normal people. They can take carbohydrates, and then 90 minutes after the exercise, they can take their proteins. They can eat like normal people. Thank you, teacher. Thank you. Thank you very much. So if there is no questions, so I would like to say thank you very much for lending your ears to our live. So please, before we end our live, please like, share, and subscribe to our YouTube channel. And thank you very much to everyone.
Hello.